Hello again, this is Dr. Tony Madril with another 3 minutes for your mental health. In this video, I'm going to be answering the question, how can trauma therapy help me overcome my fear of traveling? Following trauma, the nervous system may become hypersensitive to stress. Another consequence may be that that part of the mind that holds on to that traumatic memory and the related stress may try to protect the person by activating the body's fight, flight, or freeze response when confronted with stressful yet innocuous situations in life. For instance, a traumatized person may begin to feel intense fear and anxiety when planning a long trip to a desired vacation destination. They might even think, if I get on that plane, I'm going to have an awful panic attack. They're going to have to make an emergency landing just to get me to a psych hospital. What is more, that person may also begin to experience unusual physical ailments, such as lower back pain and vomiting as the travel date approaches. This may ultimately motivate them to cancel their travel plans and to begin limiting their activities to familiar places. In this case, a memory of past trauma may be feeding the fear of traveling. As such, it would be important for the person to receive an evidence-based trauma treatment such as eye movement desensitization and reprocessing therapy, or EMDR for short, to help them to process that underlying traumatic memory and to deactivate any future emotional responses to it. Moreover, to accelerate the mind's ability to transfer the positive outcomes, the positive experience of receiving EMDR therapy to other feared situations, the person may also benefit from receiving another evidence-based treatment such as ego states therapy, which works with the unconscious mind to help resolve the negative effects of trauma. Ego states therapy can be used to inform the protective parts of the unconscious mind that the person's adult self is now fully capable of successfully managing the distress related to travel as well as other stressful situations in life. To this end, the therapist may offer the client a mental exercise wherein they imagine or envision themselves engaging in an internal dialogue with the part that fears flying and sharing with them all of the practical tools and techniques that they've been learning in therapy and beyond to successfully manage that feared situation. To prepare for this internal dialogue, the client works with their therapist to develop these new skills, which may include envisioning themselves confidently using them throughout the plane trip without panicking. If you would like to learn more about best practices for working through trauma symptoms, I invite you to subscribe to my YouTube channel and visit my website. Thank you.